In second-line therapy of lung cancer, we typically follow NCCN guidelines. We have a patient decision support tool that we put in place, which translates the NCCN guidelines into an algorithm, and it can walk the provider through what the next best test would be. So for example, if they have an EGFR mutation and they have progressed through Tarceva, depends on what the provider wants to do next. If they want to order the next step to see if they would be eligible for Tagrisso, or if they would prefer to do PD-1 inhibitor. So we leave that up to the physician and patient to have a shared decision making at that point, understand expectations, what the patient's performance status is, and how they think the patient is going to do. Of course, understanding the toxicity profile and making sure the patient's able to tolerate the drug. So all of those factors need to be taken into account when a treatment decision is being made. In some scenarios, a best supportive care might be a good option. If the patient's performance status is very poor and they feel that doing aggressive therapy is not the best option, we have studies, as published by Jennifer Temmel, which talked about doing best supportive care and actually adding survival. At this time in cancer care, drug costs continue to rise. The value of different therapies and the clinical utility of clinical therapies need to be taken into consideration. We all recognize that there's no direct correlation with how the drug is being priced to what value the drug is actually adding to the patient. So value, I mean by clinical utility and clinical benefit. Is it really adding survival benefit, quality of life improvement? So there's no direct correlation whether if the drug is adding survival benefit and how it's being priced, and in situations where it does not add any survival benefit and how it's being priced. So that being said, we have not made coverage policy decisions based on drug pricing just yet. I think that is something that all payers are looking at, all the different stakeholders are looking at, considering the cost of care continues to rise, and it is becoming unsustainable truly.